Hi, I want to welcome you to another section of teaching on BPH, benign prostatic hyperplasia. This is food to avoid to prevent increase in the swelling. To prevent it, or even if you have been diagnosed, to reduce the prognosis. Now, there are a food that you must avoid, or you have to apply it very, very caution with it. First one is starch. Starch in the form of white bread, pasta, rice. They can increase the risk of enlargement in the prostate. These are the prostate, that's the enlargement right here. This is normal. So, due to the high glycemic index in starch, this will increase your risk for prostate enlargement. Now, also bear in mind that you need to avoid food that is very, very greasy and fatty, because it will make you it kind of increases the inflammation and make those prostates to be enlarged, because your kidney will be working so hard to get rid of them. Dairy products is also something you need to avoid, like milk, cheese. It is associated with increase in prostate enlargement. So try to avoid possible intake of dairy products, as much as you could. If you can't avoid it, please apply caution. Dairy products, take in limitation if you must to. Mostly when consumed in high amounts. So this is very, very important. Also, high protein diets can increase your prostate. High protein diets. Now, bear in mind that you cannot stay away from protein, but everything will be in moderation. If you eat high protein diets like animal protein, it can put you at risk for increased enlargement, like red meat. Avoid red meat as much as you can. If you eat it in a large amount, that will definitely put you at risk. Fish is good, turkey is good. Any food that does not contain a lot of fats is good for you. So try to avoid red meat as much as you can. This is very important. Also, if you smoke, try to avoid smoking. Quit smoking if you can. This is very important, because smoking will increase your risk for prostate cancer. Also, alcohol in large consumption will put you in a very big risk. Quit smoking if you can. If you have been diagnosed with prostate cancer, and if you are at risk for prostate cancer, I encourage you to quit smoking completely. Please, if you have family history of prostate cancer, it is good to pay attention to your body. See your doctor, get assessed. This is not a joke. This is not a joke, because high consumption of beer, it will increase BPH, because of the content. Even though evidence base has not given us much study on that, but everything still depends on how much you consume, in moderation. But monitor your body closely. Monitor your body. Know what is good for you. If you feel any or notice any abnormal feelings within your body system, please try to stay away, because alcohol is a diuretic and it can increase it can increase the risk for prostate cancer. And this is very important. I will encourage you to engage in physical activity. Lifestyle modification is very important at this time. Drink enough water. Stay away from stress. If you are stressed, try to limit your stress level. Okay? If you can't go to the bathroom, you have noticed you have any difficulties with urination or any abnormal feelings within your urinary system, please, it is time to see the doctor. This is Dr.withSwag. Pay attention to your health. See your doctor regularly. Get assessed. BPH. This is not fun. Let's look for a way to avoid the prognosis. Follow me on Instagram, Twitter. I will discuss more on things to do to prevent this prognosis. Thank you, Dr.withSwag. Have a nice day. Bye.